Hi, this is Dr. Bernstein of Dr. Bernstein's Diabetes University. Tonight we're talking about the latest issue of the journal Diabetes Care, which is published by the American Diabetes Association. This is the June 2016 issue, which is about 50% devoted to bariatric surgery, which is the kind of surgery where parts of the intestines or stomach are cut off from the digestive system so that food doesn't get fully absorbed. The idea is that diabetics are overeating, and if you only allow a smaller amount of that excess food to be absorbed into the system, their blood sugars will improve. And what they find is that this is pretty much the case, but the extent of improvement is usually exaggerated in the reports. And the question becomes, should you really be doing major surgery that has a small effect when there are other alternatives such as that prevent overeating that might be more effective? A classic example of the point that I'm trying to make is an article in this journal entitled Bariatric Surgery in Obese Patients with Type 1 Diabetes. And they boast the following accomplishment. In 94 patients, the average hemoglobin A1C, which is a measure of average blood sugar, came down from 8.4% to 7.9%. It's a minuscule drop. It's a drop in average blood sugar of about 20 milligrams per deciliter. So if their average blood sugar was 190, they came down to 170. To me, this is a trivial accomplishment. Yet the conclusion they draw from this study is short-term results of bariatric surgery in patients with type 1 diabetes are encouraging, but they qualify it, but larger and longer-term studies are needed. To me, this is an indication of non-success and no need for further studies to further damage other people instead of putting them on low-carbohydrate diets. Now, as we know, the standard treatments around the world for diabetes are high-carbohydrate diets, which, by the way, are part of the cause of diabetes to begin with. So instead of prescribing high-carbohydrate diets, high doses of insulin for type 1 diabetes that cause the obesity to begin with, they should be on low-carbohydrate diets. And overnight, there would be drops in hemoglobin A1C far more substantial than the 0.5% that's reported in this particular study. Now, how do you get more clues about controlling blood sugars, losing weight, etc., with low-carbohydrate diets? You go to my book, Diabetes Solution, which is available on the internet. It's available at large bookstores all over the world. And the system, while it requires effort for type 1 diabetes, precise measurement of insulin and so on and so forth, it works and has dramatic effects versus this trivial effect of major surgery. Thank you.